So, YouTube, what's good? It's your boy, Not Real. Welcome to my channel, Transcending the Esoteric. So, January 6th was Friday, this past Friday. Today is Monday, January 9th, 2018. I just got back to the crib for my therapy appointment. So Friday was my endocrinologist appointment. Sorry, y'all, but they keep giving me papers. My endocrinologist is at UNC Hospitals, which is at UNC North Carolina at Chapel Hill. So the University of North Carolina, Chapel Hill, aka Tar Heels. Yeah. So, boom! Since my last time going to the doctor, I have gained 1 pound. So I'm now 100 pounds and 5'1". So my doctor, Dr. Jane, I'm not sure if I should be saying her first name, so I'm not, but Dr. Jane, that's Jane, Jain. Very nice lady. So we went over the changes of testosterone and what's permanent, what's not permanent. So permanent. Oh, and I really like that with this, it really gave you a time frame on when you should start seeing your changes. Acne, you should probably see it between, so the chart features the effect, its onset, and maximum. So maximum, the length of time. Onset, I'm guessing, is when you should probably start to see, but the maximum is the time frame for those, the max time period. Okay, you get, that's why it's called a maximum. I have been informed that the masculinizing effects of testosterone therapy may take several months to become noticeable and several years to be complete. Some of these changes will be permanent, including possible hair loss, especially at the temples, at the crown of my head. You know, like when guys or even girls, when people have their hair cut really, really short, you see that little swirl in the middle of their head, crown of your head. Possibly male pattern baldness, facial hair growth, example, beard, mustache, no, that's a goatee. No, mustache. Yeah. Did you deepen the voice? Increased body hair growth, arms, leg, chest, back, buttocks, abdomen. I actually have hair in all of those places. And enlargement of my clitoris. Waiting on that. Not even gonna lie. Definitely waiting on body growth. So, an effect, skin oily, so acne, onset 1 to 6 months, maximum 1 to 2 years. Facial, what everybody wants. Facial hair / body hair growth, onset 6 to 12 months, maximum about 4 to 5 years. Jesus Christ. Whew. Scalp hair loss, 6 to 12 months, no maximum. Increased muscle mass strength, 6 to 12 months, maximum 2 to 5 years. Fat redistribution, 1 to 6 months, 2 to 5 years maximum. Cessation of menses, I'm not sure what that is, but 1 to 6 months onset. No maximum. Clitoral enlargement, 1 to 6 months or 1 to 2 years maximum. Vaginal atrophy, I think that's when she was like your walls start to not deteriorate, but they get, okay, they essentially start to deteriorate because they no longer have estrogen there. Excuse me. You will no longer have estrogen as your main hormone, so yeah. Deepening in the voice, 6 to 12 months or maximum 1 to 12 years. Basically, we went through what you eat, what's your body like. Do you any drugs, alcohol? Please be very, 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 very. So, okay, honestly, Dr. Jane was very laid back, chill. Now I don't know if that's because before I went to my appointment, But yeah. So she was like, "Do you do any substances?" I'm like, "Nah, I don't smoke. I don't do tobacco. No tobacco whatsoever." But one thing she did say is that marijuana can create marijuana creates estrogen. So, so she was like, it might not be, you know, a very, very, like, have a huge effect, but it could affect, like, things like fat reach, like, minimizing my breast tissue. So I was like, but, you know, I'm not really worried about that because I plan on starting to work out 6 days a week. And also with my workouts, you guys, I will also be posting my workout regimens, and I will also be posting pictures of the transitions of my body, especially with working out and on T. When I say I'm taking pictures, you know, of course, I have to censor my chest, but I will be taking body pictures. You will be able to see. So that's pretty much it. One thing she did say, she asked me about fertility, like, do I want children, which is really good, because testosterone is not a birth control. You can still get pregnant on testosterone. You can still be pregnant on testosterone. So anyways, she referred me to a fertility clinic. That way I can check and see what my options will be with them, see prices, test my eggs, test my fertility limits, how fertile I am, and blah, 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 this, that, and the third. So, she referred me to that endocrinologist, fertility endocrinologist. That way I can see what options I would like to do before I start testosterone. And she was like, just let her know what all I wish to do. And pretty much just let her know. But in the meantime, she did say she would prescribe me for something to start my period, to stop my periods, to stop them. And honestly, I'm trying to see what that is. Probably should have took a picture of it. Right now I'm trying to find out. It starts with a P. I want to say Prodigen or Pro something like that. I'm not too sure. I'm looking for it right now. You know what? Can't even find it. Can't even find it. So I can't even find it. I'm not sure what it is called, but I did try to look it up, but I didn't find it, but I will try to look it up again for y'all. But that's pretty much it. That's how my endocrinologist appointment went. We went over, she tested my heart rate, all that stuff. And then at the end, they drew blood. They had to do blood tests. I don't know how many blood tests I'm getting done, but I knew they drew 4 valves, so 4 tubes of blood. I don't know if that's 4 tests or like what all they're testing for. But yep, that's pretty much how my appointment went. So after, so I'm going to give the fertility endocrinologist about a week to hit me up because I want my tea. Like, it's point blank period. Like, I want my tea. Like, don't get me wrong, I'm stubborn. But here's the thing. One, I'm 20 years old. And I have no intentions of raising my children inside a single parent household. So, 1. For 2, I'm not carrying my children. Do you see what I'm saying? You feel me? I'm not carrying my kids. So, they are actually going to have to extract my eggs and then freeze them, which brings me to point number 3. Cost. Okay, it is not cheap. Alright, so on top of that, and a lot of, so my insurance, I have Blue Cross Blue Shield of North Carolina. It went a lot of clinics. Well, she actually told me a lot of insurance don't cover fertility services. So not paying for that out of pocket right now. Number 4, I'm not trying to be waiting 4 months for tea. So, like I said, if they don't hit me up in a week, I'm gonna hit up my endocrinologist, and I'm sorry, y'all, my head itch. I'm gonna hit her up, just like, yeah, I think I'm gonna just go ahead and just say, bump the fertility and worry about it another time, because I really would like to get the ball rolling. So that's pretty much it. That's how my endocrinologist appointment went. Yeah, so it's pretty much how everything went. But thanks for dropping in, thanks for tuning in. I appreciate everybody who is joining me on this transition journey, or on my journey to confirmation. Well, I'm gonna keep y'all posted. Peace and blessings, y'all. Now we're out.